of Psychiatric Mental Health Nursing Faculty of Nursing at Shams University. I will talk about enhancement of quality of life among women with breast cancer. Worldwide, breast cancer is the most frequently diagnosed life-threatening cancer in women and the leading causes of cancer deaths among women. It estimated 1.38 million new cancer cases diagnosed, 23% of all cancers, and ranks second overall, 10.9% of all cancers. It's now the most common cancer both in developed and developing regions, with around 690,000 new cases estimated in each region. While breast cancer is a global issue, it is the most common malignant tumor among women in Egypt. The figure for people suffering from breast cancer is alarming. According to official statistics of the National Cancer Institute, Cairo University, breast cancer accounts for 35.1% of cases of cancer in Egypt and is the most prevalent cancer among Egyptian women. In Egypt, the median age at diagnosis for breast cancer is 10 years younger than in United States and Europe. According to the National Cancer Institute in Cairo, it's estimated most of the breast cancer cases occur among women aged before 50 years. Many Egyptian women fail to seek medical treatment or preventive screening, making it more difficult to treat cancer and by the time become highly developed in Egypt. After the diagnosis of the breast cancer, the women are faced with the diagnosis itself, personal interpretation of cancer, physical effect of the disease, long and short-term side effect of the treatment regime, and the reaction of family and friends. Younger women have greater psychological morbidity and poor quality of life after breast cancer diagnosis than older women. Particular problems for younger women are likely to include survival concern for those with young children, concern about having children when faced with a life-threatening illness, premature menopause, leading to loss of fertility, sudden onset of vasomotor symptoms, and long-term consequences of early ovarian decline. Concern also about whether a subsequent pregnancy would alter the risk of recurrence, about body image and sexuality, concern about career and work, feeling unable to change job or fearing loss of job because of insurance and uncertainty of disease relapse. Younger breast cancer survivors are at risk for impaired quality of life up to several years after diagnosis. Younger women, especially those at high risk for lower quality of life, may need interventions that specifically target their needs related to menopausal symptoms and problems with relationship, sexual functioning, and body image. Preparing younger women for the impact of breast cancer may also prove beneficial. There are various treatments of cancer, surgical stage procedure, chemotherapy, radiotherapy. Complication and side effect of cancer treatment can not only adversely affect clinical outcomes, but also influence on patient quality of life. Quality of life can be defined as self-perceived aspects of well-being that are related to or affected by the presence of a disease or treatment. As a multidimensional construct, it includes perception, positive and negative of several dimensions such as physical, emotional, social and cognitive function. It also includes the negative aspect of the somatization disorder and symptom caused by a disease and or its treatments. It's a person's view of life with satisfaction and pleasure with his life. In the case of breast cancer, disease severity and type of treatment, surgery, radiotherapy, or chemotherapy, or a combination of all three, have a clear influence on the patient's subjective perception of the disease. Their effect on quality of life are also modulated by personality trait, personal resources, availability and perception of social and family support, as well as by the strong cultural association between the breast and woman's self-esteem and sexuality. The main resources for poor quality of life after breast cancer is related to worrying about body image and sexuality, psychological stress and anxiety, fear of recurrence, sleep dysfunction, fear of loss of fertility, pain, fatigue, and impaired physical functioning. Carcinoma of the breast has considerable impact in the form of psychosocial effect of the physical and aesthetic deformity, which can include negative effect on body image and on sexual function, which adversely affect quality of life of the female. WHO defined quality of life as individual perception of their position in life in the context of the culture and value system in which they live and in relation to their goal, expectation, standard, and concern. Moreover, quality of life is a state of well-being that is a composition of two components: the ability to perform everyday activities that reflect physical, psychological, and social well-being, and the patient satisfaction level of functioning and control of disease. Quality of life refers to psychosocial, emotional, and physical outcome of healthcare treatment as perceived by the patient. Patient interprets their feeling of well-being using expectation, perception, experience, and religious or community beliefs. Quality of life following treatment of malignant disease is an area of increasing interest. Through good quality of life, the patient can achieve satisfaction with daily living function. Another factor that influences quality of life among breast cancer survivors is general health that is comprised of health status, comorbidities, upper body function, lifestyle as physical activity, body mass index, smoking, life burden, stress, and social network as social support. Participation in breast cancer-specific rehabilitation program, whether group psychotherapy, exercise program, psychoeducational intervention, or individual psychosocial support during after treatment improves quality of life. Also, appropriate intervention should provide information, teach skills to cope with problems and manage stress and increase self-efficacy in the context of a culture and background. Supportive care includes nutrition programs to help reduce treatment side effects, exercise regimes, instruction in the many arts of mind and body control, such as biofeedback, Tai Chi, and self-hypnosis, individual or group counseling for the patient, family and friends, intellectual and creative pursuits from cheese to art and music therapy, and spiritual guidance to increase the woman's ability to cope, improve lifestyle, and enhance quality of life. Psychosocial intervention enhance quality of life and decrease the stress in breast cancer patients. Treatment techniques should include training patient in relaxation and guided imagery techniques, providing patient with educational information, the opportunity to express emotion, encouraging the exchange of social support with the other patient, and training patient in cognitive and behavioral coping skills for dealing with range of outcomes. Example, nausea, vomiting, pain, emotional distress, change in quality of life, and the progression of illness. Early work should focus on behavioral methods for managing the health problem associated with chemotherapy, advancing of medication, psychological treatment to decrease patient psychological distress and enhance their quality of life. The two treatment modules can be used: cognitive behavioral as stress management, cognitive coping skills, and supportive expressive as focusing on the expression and processing of emotion. Psychosocial intervention results not only in improved outcome for breast cancer patients, but also for their family and reduce healthcare efforts as medical procedure. Psychosocial intervention consistently show beneficial effect on emotional adjustment, functional adjustment, treatment, disease-related symptoms, and enhance the patient quality of life. Finally, however, the success of this program depends on their use in real-world setting, and this may be influenced by factors such as availability of good setting, a good program, and associated cost of the program, and confidence to assess services. Thank you.
would be Dr. Najlaء Mahdi, أستاذ مساعد قسم تمريض جراحي باطني كلية التمريض جامعة عين شمس. The book titled Improving Self-Care Practices of Women to Prevent Post-Mastectomy-Related Complications.
learning package to improve self-care practice for women to prevent post-mastectomy related complications. Breast cancer is the most common malignancy and the second most common cause of cancer death after lung cancer in women worldwide. In 2012, 1.7 million women were diagnosed with breast cancer, and there were 6.3 million women alive who had been diagnosed with breast cancer in the previous 5 years. Since the 2008 estimates, breast cancer incidence has increased by more than 20%, while mortality has increased by 14%. Breast cancer is also the most common cause of cancer death among women in 2012. In the Eastern Mediterranean region, breast cancer is by far the most common cancer, even when considering men and women together, with 2 times more cases than lung cancer or bladder cancer. Breast cancer is the most important cancer, with women in an increasing number in incidence in the developing countries. It is by far the commonest cancer among Egyptian women and represents 37% of all female cancers. Many women diagnosed with breast cancer may undergo a mastectomy with its different types as a part of treatment for breast cancer. Modern treatment of breast cancer is most developed in most developed countries is based on multi-modality approach, combining surgery with radiotherapy, with chemotherapy, with hormonal therapy. Also, these treatments have improved patients' outcome. They have been associated with substantial adverse effects. A mastectomy is a surgical procedure performed to remove one or both breasts. It is usually performed to treat breast cancer and involve removal of breast tissue and sometimes the nearby lymph nodes. Like in major surgery, mastectomy can lead to complications, so it is important to patient talk with the doctor about these risks and any unusual symptoms. General complications. A mastectomy may lead to problematic complications after surgery. Wound on the chest wall may persist long term, leading to skin loss, infection, hematoma, formation of hard scar tissue at the surgical site, and bleeding into the area. In some cases, another operation is necessary to stop the bleeding. Complications related to lymph node removal. Lymph nodes underneath the armpit may be removed during a mastectomy to prevent breast cancer from spreading. Lymph node removal can cause shoulder pain, stiffness, severe stabbing or burning sensation in the breast and armpit area. Lymphedema or swelling of the arm may also occur on the same side as the breast that was removed. Nerve damage may also lead to numbing on the inside of the arm or muscle weakness in the back and chest wall. Serious complications. Mastectomies may lead to serious complications that are possible with any surgical procedure. Potentially serious complications include breathing problem, infection of surgical wound, infections that spread throughout the body, blood loss, reaction to anesthesia or medication, heart attack or stroke during the surgical procedure, and blood clots that form in the legs and may travel to the lung. Women's education regarding early prevention of the complication and self-care should be overemphasized in clinical nursing practice. Nurses play a vital role when interfacing with breast cancer survivors and should engage in prevention of post-mastectomy complications, treatment, and patient education. Prevention of the complication is a very important part as a nurse role. Nursing care for prevention of post-mastectomy related complication would not be successful without the careful assessment of patient need, as well as self-care education tailored to each individual. This is aiming to bridge the gap by taking into account aspects of women's daily reality in relation to current recommendation for preventive measures and self-care guidelines, the goals, treatment plans, prognosis, and expected outcomes. Inadequate self-care practices remain a significant problem facing healthcare providers in all settings and population. Based on the previous researches, it was noted that inadequate self-care practices poses a threat to satisfactory outcome, increasing patients' morbidity and mortality and increasing cost of medical treatment, cost in time and effort of care provider. In contrast, patients who had adequate self-care practices had better outcome, live longer, enjoy a higher quality of life, and suffer fewer symptoms and complications. The education process is a systematic and planned course of actions consisting of 2 major interdependent operations, teaching and learning. This process forms a continuous cycle that also involves two interdependent players, a teacher as a nurse and the learner as a patient. Together, they jointly perform teaching and learning activities, the outcome of which leads to mutually desired behavior change. There are traditional and non-traditional methods for patient teaching. Traditional methods as lecture, group discussion, and demonstration tend to have more healthcare providers as teacher input and control during encounters, while non-traditional methods as role-playing, self-learning package, and distance learning, the non-traditional approaches teachers act more as designers and givers of information. Self-learning package is a document containing all necessary knowledge for patient as student to attain one or more educational objectives independently of the teacher. Using this package, the patient can take over a large part of his or her training, while the nurse as a teacher remain available only when needed. It could be offered in a form of workbooks, study guides, workstations, video games, internet modules, and computer programs. Use of self-learning package to improve self-care practice for women to prevent post-mastectomy-related complication has many advantages as reduced travel time, travel cost for women. Women may have the option to select learning materials that meet their level of knowledge and interest. Also, women can learn and gain information anywhere. Self-based learning package allow women to work at their own pace, encourages women to take responsibility for their learning. In addition, the use of self-learning package allow for consistency of principles of adult education as enable women to meet their own learning needs, provide immediate feedback and reinforcement of learning, promote independence and actively involve women, variety in instructional methods, flexibility in relation to number of women, privacy, decrease women concern and anxiety regarding making mistakes. While self-learning package have disadvantage, women may feel isolated or miss social interaction. Women with low motivation or bad study habits may fall behind. Lack of interaction between women and educators, low completion rate due to lack of self-discipline. The components of self-learning package include title, table of content, the purpose or the general aim, prerequisites and objectives, a direction for use, an introduction, pre-test, the content, instructional aids, and post-test. Component of self-learning package should include instructions on the following topics: wound and bandage care, drainage care, warning signs for infection, when to call doctor, nutritional needs, medication, pain control, activity restriction, clothing restrictions, guideline for prevention of lymphedema. Role of nurse as a teacher in self-learning package: serve as a facilitator, resource person to provide motivation and reinforcement for patients' learning, has a role in successful transition from teacher-directed to self-directed learning, assesses patients' readiness for method, established the boundaries of patient decisions about their learning. Teachers' role are the maintenance of educational standard, teaching objectives, and evaluation and availability to the patients. Finally, when the nurse as a teacher uses self-learning package for women post-mastectomy, this will help patients to have adequate knowledge and self-care practice for prevention of post-mastectomy-related complications, have better outcome, live longer, enjoy a higher quality of life, and suffer fewer symptoms and complications. Thanks.